So even if you're skeptical of social distancing and masks, even if you believe the mass quarantines we're living under are insane and counterproductive, and of course they are, it should be pretty obvious that you want to keep sick people away from places where there are a lot of elderly people, nursing homes specifically. In the state of New York, though, the Governor Andrew Cuomo did the opposite. Nursing homes were required under the Cuomo administration to admit people infected with coronavirus. Now, 5,000 or more nursing home residents in New York have died of the virus. 5,000. That's more deaths than in any other state except New Jersey, and that's just in nursing homes. Nicole 𝐢𝐧𝐝𝐞𝐲 is a New York Assemblywoman and congressional candidate. She joins us to consider what is a growing scandal in New York. Nicole, thanks so much for coming on. Why would they do this?
Well, thank you, Tucker, for exposing this, because it is truly an outrage. On March 24th, Governor Cuomo said, "My mother is not expendable, your mother is not expendable," and yet the very next day, he signed an executive order mandating nursing homes where our most vulnerable mothers and fathers reside to accept COVID-positive patients. And now, as you mentioned, there are 5,000 residents of nursing homes or patients that have been put into nursing homes that have died, which account for 25% of the deaths in the state of New York and 30% of the deaths in the community that I represent. And I believe that we need to have an independent investigation, and we cannot trust the state of New York to do an independent investigation. I know the governor's called on the Attorney General to do so, but this is the Attorney General that he handpicked in a special election to be the candidate. So I mean, we have to have a federal investigation. That will be the only way we get an actual, true, independent investigation to take a look at what exactly occurred here. And I could tell you something else, Tucker, because I've been on the ground with these nursing homes, and they did not have the proper PPE, the proper protective equipment to care for these individuals. So not only did the governor mandate that they accept COVID positive, but then he didn't even provide the proper protective equipment to keep them safe and stop the spread from within the nursing homes. And we had pushed him on this. We said at least mandate the local municipalities to provide this protective equipment.
So I knew Cuomo when he was HUD secretary in the 90s under Clinton. He's an extremely political person, very politically calculating, not stupid either. You're in politics. Really quickly, what was the political calculation in this decision? There must have been one.
Look, to be honest, I don't know what the calculation was at that time. All I can tell you is that it doesn't make any sense when all of us are saying that our most vulnerable, most affected by COVID, to put them in the nursing homes. My colleagues and I were scrambling for protective equipment to get to the nurses at these nursing homes because the city and the state were not providing an adequate supply. But what I can tell you is just 2 days later, on the 27th, he let 1,100 parolees, that people that broke parole, to be released from the prisons. So what shows you is his priorities, that he cared more about protecting the interests of these 1,100 criminals than he did for our elderly. And that is absolutely outrageous, Tucker.
Because they're just American citizen taxpayers. They're not criminals or vagrants or illegal aliens. So, like, who cares about them? Shut up and pay the bills. That's their view, as you know. Assemblywoman, great to see you tonight. Good luck.
Hey, thank you very much.